Well, today is Diabetes Alert Day. It's a day meant to bring awareness to the seriousness of this disease. It's one that impacts more than 37 million Americans, and it is the seventh leading cause of death in the nation. So, new for you this morning, why the CDC is calling today a wake-up call and what to do if you are at risk. The number of American adults diagnosed with diabetes is just over 28 million, a number that has more than doubled in the last 20 years.
As obesity has become more commonplace, diabetes and prediabetes are developing at younger ages.
There are 4 types of diabetes: gestational, which only occurs during pregnancies. Then there's type 1 diabetes, which impacts 5 to 10% of the population.
Where your body just does not make enough insulin by itself.
Type 2 diabetes affects 90 to 95% of the patient population.
That is where your body you're making enough insulin, but it doesn't use it well. Insulin, it goes around, picks up blood sugar and puts it in the cells. So you have insulin, you have sugar, but it can't be used.
And finally, there is pre-diabetes.
You really don't even have any symptoms. You can be perfectly normal and not have any signs and symptoms of anything until your sugars get too high.
A CDC report shows 96 million U.S. adults have pre-diabetes. 8 in 10 of those with the disease don't even know they have it.
So it's been more prevalent with the increase in obesity.
To prevent or even reverse prediabetes, Patty Summers, a nurse practitioner in the Valley, recommends maintaining a healthy lifestyle with food, physical activity at least 3 times a week, and monitoring those stress levels. Working with a doctor to understand where to make lifestyle changes can also help.
Sometimes just cutting out regular soda pop can make a huge change. So you have to understand, what are they eating? What can we do to eliminate what they're eating? What can we change that's reasonable? And we also have to be sensitive to their cultural diet.
The cost of healthcare is high, especially for those with diabetes, with the CDC calculating medical costs and lost work for those with diabetes at $327 billion yearly.
About 1 every $4 of American healthcare dollars is spent on diabetes. So it can be very expensive. So it's important to do whatever we can to prevent the development and control what we can control.
So if you do have type 1, type 2, or pre-diabetes, there are resources out there to help you, including the American Diabetes Association and local programs right here in the Valley. We did put links to those resources on our website at abc15.com.
Yeah, really valuable information, Allison.